Can you get pregnant whilst breastfeeding? Well, breastfeeding can definitely do strange things to your periods, but have you ever wondered if you can get pregnant whilst breastfeeding? You might already be trying to conceive and not ready to stop nursing yet. So can it happen? And when is the best time to conceive? And are you wondering how breastfeeding, periods and fertility all connect? Let's get into it. I'm Brooke, I'm an obstetrics and gynecology doctor, and in this video we're going to cover if it's possible to conceive, how to prevent it if you're not ready, tips for optimising your chances, and even touch on IVF whilst breastfeeding. So, can you get pregnant whilst you're breastfeeding? The short answer is yes, but actually there's a little bit more detail needed. So while breastfeeding, especially in the early months, many women don't ovulate. The hormone that's involved in breastfeeding, which is called prolactin, suppresses the other hormones that are involved in the menstrual cycle. So they do prevent ovulation, meaning that most women experience at least a few months without a period whilst they're nursing. And this natural period of infertility is actually called lactational amenorrhea. It's more likely if your baby is exclusively breastfeeding, if you're nursing every 4 to 6 hours, and if your periods haven't returned yet. But breastfeeding is not 100% foolproof as a form of contraception. Ovulation can sneak in before your first period, meaning that you can actually get pregnant without realising that you've become fertile again because you've never seen your periods restart. So how can you prevent pregnancy whilst you're breastfeeding? Well, breastfeeding as contraception can be 98% effective at preventing pregnancy, but only if all of those conditions I've just mentioned are met. Otherwise, the method can be less effective. So your baby must be less than 6 months old. You should be exclusively breastfeeding because any feed that you're giving by bottle, either expressed milk or formula, means that your breasts don't get stimulated, which increases the likelihood of prolactin levels dropping and ovulation occurring unless you're stimulating the nipples at the same time, for example, using a pump every time you give the baby a bottle. And third, your periods must not have already returned. Now, I do still recommend that if you strongly do not wish to conceive, then you should use an additional method of contraception whilst you're breastfeeding, because there might be some times that you are separated from your baby, or if your baby sleeps through the night, which means they go longer periods without feeding. That might stimulate ovulation and you could conceive unexpectedly before you even see your first period. So after you've had the first 6 weeks after baby's born, you can have most options of contraception, including the combined or progesterone-only pills, coils, implants, etc., even whilst you continue to breastfeed. So discuss your options of contraception with your doctor. So when is the best time to try to conceive? Well, the return of your period is a really good sign that your fertility is back. For most women, their periods return around 6 to 12 months postpartum, but it varies widely. Some people, it might take them 18 months to get their periods back, or they may not get them back at all until they stop breastfeeding completely. So how do you optimise your chances of conceiving whilst you breastfeed? Well, whether or not your periods restart does depend on the frequency of nursing. So the more often your baby feeds throughout the day and night, the less likely your periods are to restart. We do also think that night feeds are even more important for suppressing ovulation. So potentially if you can increase the gap between your night feeds, or if you give night feeds to the baby with a bottle instead, it might be enough time to allow ovulation to restart. Also, you might find that with the introduction of solid foods, that can reduce the amount of milk that your baby takes and therefore the frequency they need to feed. Some people find that if they are using bottles or dummies, pacifiers, for your baby, they're suckling more often and they may not need to feed as much. That can reduce how often they need to do nipple suckling, which means you could increase the likelihood of your ovulation. You can try to conceive at any time that you're ready, even if you're breastfeeding, but we generally do recommend a gap of around 18 months before you conceive again. And that's just the WHO recommendations for a healthy pregnancy, even more important if your last baby was born by cesarean section. If you're thinking of getting pregnant soon, you should also ensure that you're eating a balanced diet with plenty of nutrients, as breastfeeding can deplete your reserves. You should track your ovulation using your basal body temperature, or ovulation kits can help if you're not seeing a regular period and you're trying to work out whether or not you could be ovulating. So can you get pregnant whilst you're breastfeeding? Well, as I said, the short answer is yes, but there are factors above that will affect how quickly this happens. If your periods have returned and they are regular, then it is likely that your fertility is close to what it was before you had your last baby. If you're wanting to conceive and your periods haven't restarted, you might wish to consider weaning your baby from the breast if this is right for your family. And the quicker that you stop breastfeeding, usually the quicker your periods will start again and the quicker you'll return to your background level of fertility. Most women find their periods would return between 9 and 18 months postpartum, but we know that continuing to breastfeed will cause spikes in your prolactin levels, and that can be enough to impact on fertility. So what about IVF? Well, if you haven't conceived after a year of trying, or 6 months if you haven't been having regular periods, you should obviously see your GP and they can check to see if you're ovulating. And if after you've had tests and treatment, you are referred for fertility treatment, you might be advised to reconsider breastfeeding. Now, this is a very under-researched area. It lacks firm evidence, but the recommendations for stopping breastfeeding before having fertility treatment is because potentially breastfeeding could decrease the success of an IVF cycle because it could impact on embryo implantation. And we also know that some, but not all medications that are used in fertility treatment could potentially be harmful to your breastfed child. You should consider the timing of your treatment and your medications as well for the length of time that you intend to nurse for, and you can discuss it with your fertility doctor. So it's worth considering when you might be having any fertility treatment and what medications might be used for you and how long you're planning to nurse for. And you could discuss that all with your fertility doctor to come up with a plan. So ideally, yes, you should wean off of breastfeeding prior to having IVF or a frozen embryo transfer, but completely stopping may not be necessary if you are just feeding once or twice a day. Now, it can be very hard emotionally if you feel that you're needing to choose between your future hoped for child and meeting the needs of the child currently in your arms. If you manage to conceive, is it fine to continue breastfeeding during pregnancy? Generally, yes, it's fine to continue to breastfeed during pregnancy, especially if your pregnancy is low risk. If you've got any complications with your pregnancy, then you should discuss it with your medical team, especially if, for example, you're at risk of preterm birth. However, you might notice a couple of significant changes that could affect your journey and whether or not you choose to continue. Firstly, a change in the milk. So your toddler might actually have a very different reaction to their feeds than before. And this is because the taste of the breast milk might change for them due to the pregnancy hormones and also because your supply can decrease during the pregnancy. And second, you might experience a breastfeeding aversion yourself, and that can result from the hormonal changes and also because you might notice that engorgement and soreness in the breast that happens during the pregnancy. So you might find breastfeeding more of an unpleasant or uncomfortable experience, and it's totally up to you, but if you want to carry on, you can. So to summarise, yes, you can get pregnant whilst breastfeeding, but the timing of your feeds, how old your baby is and whether or not your period has returned are key factors. If you want to conceive, you might want to adjust how often you feed your baby, particularly overnight, and track your ovulation. And if you're not planning to conceive, I still recommend you use additional contraception and don't rely on just breastfeeding because you can still conceive, as I mentioned before. So do you have any other questions or experiences about breastfeeding and pregnancy to share below? Drop them in the comments.